Good afternoon, and welcome back, everyone, to the London Ball Foundation Education Summit 2024. My name is Derek. I'm one of the co-founders of the London Ball Foundation and the chairman of the Friends of LSE in Hong Kong, the Alumni Association. I will be MC for this afternoon session. As we convene, our focus now shifts to the critical topic of health. In our following panel discussion, we'll explore how educational institutions can prepare for the challenges of rapidly aging populations in Hong Kong. But before the panel starts, we'll first like to welcome the Honorary Advisor of the London Ball Foundation, the Honourable Dr. Koh Wing Man, GBS JP, to deliver a keynote speech for us to kick off the afternoon session.
Thanks for your kind introduction, but it's not going to be a keynote speech. Ms. Sandy Lau, Ms. Margaret Lam, co-founder and chairladies of the London Ball Foundation, honored guests, speakers, ladies and gentlemen, it gives me great pleasure in taking part at the London Ball Education Summit. As a platform seeking to unite UK graduates from Hong Kong to work together and contribute to our city's future development. The London Ball Foundation's mission is highly commendable and most befitting at this moment. As Hong Kong is to embark on a new and challenging venture to rediscover the direction, pathway, and momentum for our next stage development, we need to steer through the various restraining factors, notably talent supply. Although the healthcare system in UK and Hong Kong differs in many respects, nowadays, Hong Kong's dual-track healthcare system did evolve from a public sector-dominated system, very much like that of the National Health System, NHS, of UK. Furthermore, much of the original elements of our medical education and training system could be traced back to the UK system. With extensive interflow and cross-fertilization in the past many decades, we can see the medical sector and health system of Hong Kong and UK are closely tied up till now. A very prominent example is the specialty training and accreditation system for doctors. Most doctors from my generation and before actually received on-the-job specialist training locally and partly in the UK, under a curriculum prescribed by the respective Royal Colleges in UK, and took examination in the UK, or at least a conjoined examination with the Royal Colleges held in Hong Kong. It is only till 1993 that Hong Kong Academy of Medicine was established to be the local authority in the area of postgraduate medical education and training. Up to this moment, many of our local academy colleges are still maintaining a very close relationship and holding conjoined examination with the Royal Colleges in Hong Kong. Many of our leaders in clinical medicine, medical education, and health services and public health are actually UK graduates. In the area of public health and healthcare policy, we also see vital and continuous collaboration between the two governments. As an example, in October 2015, I signed the Memorandum of Understanding on Health Cooperation between the government of the Hong Kong SAR and the government of the UK on behalf of the Food and Health Bureau of Hong Kong. And the memorandum provided for collaborations in many areas, including primary care delivery models, non-communicable diseases, including care of older people with dementia, use of technology in healthcare in supporting different service delivery models, design and development of new hospitals, and redevelopment of existing hospital facilities, sharing of experience on the regulation of traditional medicines, regulatory mechanisms relating to medicinal products and medical device for human use. Last but not least, health protection, including antimicrobial resistance and laboratory aspects of the prevention and control of infectious diseases. I'm sure much of these areas of collaboration are as relevant then as today. When we are similarly under the challenge of rapidly aging population and the disease associated with aging, as well as the periodic and recurrent threat of serious infectious diseases, it is therefore most befitting to have the next panel in this summit devoted to health issues. I'm sure you are as eager as I am to hear from our distinguished panel speakers on how we can tackle the hurdles in talent supply and harness the use of modern information technology such as AI, the breakthrough in pharmaceutical and medical devices, and innovative models of service delivery, etc., to enhance the quality and efficiency of health services delivery, as well as how to further UK-Hong Kong collaboration in the area of health. Thank you very much.
Thank you very much, Dr. Cole, for taking the time to join us and sharing with us such an insightful speech. Now, can we please invite our chairlady, Ms. Sandy Lau, to present a thank you certificate to our honorary advisor, Dr. Cole. Please remain on stage. Now, before the panel discussion, we would like to take a group photo with all the panelists. For this session, our moderator is Ms. Sharon Tang, a former journalist of TVB. Our other distinguished panelists include Professor Sophia Chan Siu Chi, former Secretary for Health of the SAR government, Professor Feng Hong, CEO of the CUHK Medical Center, Mr. Carl Wool, CEO of New Frontier Group, who has especially made a day trip all the way from Shanghai for today's summit, and Dr. Kelvin Mack, consultant neurosurgeon and clinical associate professor honorary at the Chinese University of Hong Kong. Sure. Can we can we also have UCL Vice Provost, Dr. Professor Anthony Smith, to join us with a group photo? Can all London Ball co-founders and committee members please come down and join the group photo as well? Now I kindly request Dr. Cole, Mr. Wu and Sandy to remain on stage. Today we're very honored to have Dr. Ko Ing Man and Sandy to present the Outstanding Alumni Award to Mr. Carl Wu. The Outstanding Alumni Award, this is the first time we have the Outstanding Alumni Award. This award is an initiative of the London Ball Foundation aimed at celebrating the excellence of UK educator alumni and recognizing their significant achievements in Hong Kong. Today, we have the privilege of recognizing Mr. Carl Wu from the London School of Economics for his exceptional dedication and remarkable contributions to both the UK, Hong Kong community and beyond. We also extend our sincere appreciation for him for making a special one-day trip to Hong Kong, especially for today's event. Please join me in giving him a warm round of applause to congratulate Mr. Carl Wu on receiving this well-deserved Outstanding Alumni Award. Thank you, Dr. Cole. Thank you, Mr. Carl Wu and Sandy. Now, before the panel kicks off, please, we would like to share a TV show broadcasted on TVB a few months ago. I'm sure a lot of you would have watched it on Saturday afternoons that were produced. Special thanks to to the support of Miss Victoria Tang, another LSE alumni, to promote our mission of attracting talents back to Hong Kong.
其實 London Ball Foundation 中華倫敦協會由我哋幾位海歸組成嘅。喺香港嘅英國畢業生咧，保守估計係大約20萬人啦，都係一個幾唔細嘅數目。咁我哋好希望咧，透過不同嘅項目啦，去凝聚呢班海歸啦。例如我哋嚟緊會舉辦嘅 London Ball 啦，會頒發一啲嘅 Outstanding Alumni Award， 同埋我哋同中文大學 partner 去舉辦嘅 Education Summit 教育峰會。咁希望去鼓勵喺海外讀書啦，同埋居住嘅香港人翻嚟香港創業就業、持續進修同埋回饋社會嘅。
嗰陣就話香港希望要轉型啦，希望要去搞呢個創科啦。咁我係好有呢個心，好希望係將我呢個創新嘅技術能夠帶翻去自己出生嘅地方嗰度，將佢發揚光大。咁所以有一咗咁樣嘅決定之後，就即係立下決心啦，就帶埋我太太啦，同埋小朋友咧，就成家喺2018年嗰陣咧，就即係成家搬翻嚟香港嘅。
始終個歸屬感咧，都係喺翻喺香港呢一度，呢個係一個都幾重要同幾大嘅原因嘅。
他們在國際賽中奪得獎牌，也選擇回來香港，積極培育新一代運動員，為香港嘅體壇做出貢獻。
我讀完書之後咧，想翻嚟香港繼續打劍咯。想將劍擊普及化，同埋都想即係多啲教下小朋友劍擊咁樣咯，等佢哋認識運動或者劍擊。咁無論你去到邊個位啦，都要堅持確定你個目標。好難嘅時候咧，都要用一個正面嘅心態去面對。如果遇到啲唔好嘅事啦，或者可能輸咗場比賽，只不過係一次咯，就係嗰一次。咁其實你個 journey 啦好長嘅，咁所以你要堅持啦，有一個 positive attitude， 咁你就會達到你個目標啦。
加油！
加油！
即係俾我揀一次，一定會翻到嚟香港玩咯，因為呢度真係俾咗好多機會我咯，亦都我覺得真正係幫咗我去達成即係我個 full potential 喺體操上咯。
但係再諗深一層，我覺得我都想喺香港發展，始終屋企人喺香港啦，咁同埋香港其實係一個中心點嚟嘅，國外同埋國內嘅運動員亦都可以透過喺香港呢個地方做一啲唔同嘅交流，所以我都舉辦咗好多唔同嘅國際賽事啦，亦都帶咗啲國外嘅朋友去大中華嘅地區度去比賽啦、去交流啦，亦都去體驗生活嘅，咁我覺得呢個好有意義咯。
在这一集中，中华伦敦协会邀请了几位在香港成长的艺术创作者，分享他们对香港的情和他们回流的心。
夢想同埋香港作為香港藝術家係國際嘅夢想。
其實嗰幾年我好高興，就係因為能夠喺香港去打好個基礎，去 prepare 我之後去到美國同埋歐洲嘅發展咯。喺亞洲啦，或者香港、澳門啦，我相信其實音樂發展嘅空間係好大，絕對係非常之大。
希望可以將我做嘅廣東歌，或者將廣東歌嘅文化可以 spread 去其他唔同嘅地方，等大家知道我哋香港人，我哋做緊啲乜嘢嘅廣東歌咯。其實我覺得香港係一個真係好有多元文化嘅一個大城市啦，有唔同種族、唔同膚色嘅人都喺度居住啦，咁大家都好融合。即係呢度香港嘅歷史，令到我嗰陣時喺度長大，吸收到好多唔同西方嘅文化、音樂啊，亦都影響到我喺音樂上邊嘅領域咯。因為香港呢個地方好多音樂咧，本地音樂都由英文歌又轉化咗變成一啲好地道嘅香港廣東歌。咁其實係好獨特嘅呢個地方。我自己覺得呢個地方雖然好細，但係我哋擁有嘅，我哋係好多寶藏喺度。即係我哋香港嘅歷史，俾我哋呢一個過程裏面嘅經歷，其實已經係一個寶藏。因為喺呢個經歷裏面，我哋香港即係締造咗好多好好嘅音樂啦，同埋好多唔同行業嘅出色嘅人士。即係大家呢個咁細嘅地方，一個咁細嘅城市，令到我哋喺呢一個全個世界裏面，都成為一個好知名、擁有好獨特嘅生活文化嘅一個地方。咁所以我哋好 feel proud of 自己係一個香港人。
It's very encouraging to see all the interviewees sharing their extraordinary stories as overseas graduates returning back to Hong Kong, contributing back to the Hong Kong community. Now, before we start our panel, we would like to invite UCL Vice Provost of Faculties, Professor Anthony Smith, to say a few words.
Well, thank you so much. And Dr. Koh said he wasn't going to deliver a keynote, and then he did a fantastic one. Thank you so much. But I'm definitely not going to deliver a keynote. But I did just want to sort of say, if I may, on behalf of Sandy and the London Ball Foundation, a very warm welcome this afternoon to a whole bunch of you who I know you weren't here this morning because you were doing your studies. And so for those that weren't able to be here this morning, a really warm welcome to this afternoon's discussions. I hope you find it interesting. And I guess I hope, given that the London Ball Foundation is about the alumni of graduates of universities in London, of which mine is one, alongside LSE, King's, Imperial, Queen Mary. You've got a snapshot of what your future could be like, because you too could be one of those alumni in not too many years' time. And I hope what you'll get from this afternoon are some insights into what it would be like studying. And you have an amazing choices in front of you, because you've got wonderful universities here in Hong Kong, 5 in the top 100 in the world, just as you have, if you look elsewhere, including, of course, I'm biased, but to London in the UK, where we've also got wonderful universities. So I just hope the sessions this afternoon will give you a chance to maybe open your minds to think about things that you perhaps haven't thought about before as to what you might wish to study and where you might wish to study. But I really hope you have a great afternoon, and it kind of you fire your passions for what you want to think about and do in your futures. But I hope you have a really enjoyable afternoon. Thank you.
Now, shall we invite our moderator, Ms. Sharon Tang? And all our distinguished panelists. First of all, Professor Chan Xiu Chi. Professor Feng Hong. Mr. Carl Wu. And Dr. Kelvin Mack. Please be seated.
Hello, everybody. Welcome back to the London Ball Foundation 2023 to 24 Summit. Welcome back. I'm Sharon Tang. I'm really happy to be here today to be joining you all. This section, we will be talking about the very meaningful topic of health. So first of all, let me first introduce again today our esteemed guests and speakers who have taken their time out from their busy schedules today to be joining us in this very fabulous summit. First of all, we have sorry, I'm so sorry. We have Professor Sophia Chan, former Secretary for Food and Health. And next to me, we have Professor Hong Feng, Executive Director and Chief Executive Officer of CUHK Medical Center. We have Dr. Kelvin Mack, Consultant Neurosurgeon and Hong Kong 10 Outstanding Young Persons. And then we have Professor Carl Wu, Co-founder and CEO of the New Frontier Group. Thank you all for joining us today. Now let me walk us through some of the background of today's summit. Now Hong Kong and many advanced nations, we are facing the pressure of rapidly aging population. The UN forecasts that Hong Kong will have the world's oldest population with over 40% of the city's population aging 65 or above by 2050. How old are you going to be in 2050? Do the math. Now, preparing for this great economy will test the resilience of labor markets and healthcare systems. So how should Hong Kong and other jurisdictions and educational institutions prepare for this? Now, I know that this health topic is very, very broad, and we have only this much time to cover a lot of subjects, but we will mainly, I'd like to mainly focus on a few topics. So namely artificial intelligence, and also how private sectors and universities can cooperate together, and also how can Hong Kong train enough health workers to cope with all this. And I'd just like to bring the attention to the fact that today, some of the things that we're discussing are some of the brilliant minds, brewing ideas and coming up with development and facilities and equipment that you guys, as the next generation, are going to enjoy, are going to use, or are going to think about how we can push this forward. So I hope that you guys will really enjoy and listen into what we're about to talk in the next hour or so. Okay, so let's kickstart the summit on this very interesting topic on artificial intelligence and smart technology and see what everybody has to say. So I'd really like to start talking about how, obviously with AI and a lot of smart technology, so what do our speakers think that, is this good or bad to the medical spectrum overall, and how you think that this could move forward in the future with balancing out the pros and cons? Would any speaker like to speak first?
Okay, maybe I will kickstart with that.
Sure.
That's indeed a very challenging question, especially in the past year since the release of the ChatGPT, generative AI, and large language model. And that actually has been immense interest and also development on the use of AI. Prior to that, the use of AI is mainly in narrow area, like making diagnosis on radiological films or even pathological images and that sort of thing. Very narrow field. But then suddenly it's actually broadened the scope. And then to be able to potentially transform the way we deliver healthcare, the way we communicate with doctors, the way we communicate with patients. But it's not just AI. There are still few essential components, actually, from the technology perspective, which are essential. The first is connectivity. And I think nowadays, again, we are actually seeing the potential of not just 5G. They are now talking about 5G plus or 5G advanced, and then integrated network connectivity incorporating Wi-Fi, Bluetooth, and in my hospital, just next door, ultra-wideband as well. All these integrated created connectivity, which is actually which is close to real time with reduced latency. So that's one thing. The other is where the data are coming from, because if you're talking about intelligence, you have to do data. And then with that connectivity is, of course, all the development on IoT, IoMT, which is Internet of Things, Internet of Medical Things. So adding all these together on top of like digital health record and that sort of thing, which the government of Hong Kong is also embarking on, the eHealth Plus initiative. So everybody with that data, then you suddenly, the potential of creating real sort of intelligence, which is actually be able to supplement sort of what we do as human beings. And there's actually a lot of complementary roles. So the whole healthcare is projected to be transformed in the next decade because of that. And you will be the generation that will be able to generate that in the future. I think it will be very challenging. And you can see that healthcare innovation is not just about not coming from doctors and nurses. It's coming from everybody. Everybody, even the customers, patients themselves will be contributing to healthcare as well. So I think that's the most exciting bit, which I feel very much as I enter into the 65 years old above age bracket.
Well, that's a very insightful exchange. Any more input on like how AI is helping us nowadays in terms of medical development?
Okay, I totally agree that whether AI is good or bad, it is essential, and it is now actually, slowly or quickly entering into our lives. Obviously, in many of the current interventions, for example, given by healthcare professionals, previously there is counseling, there is face-to-face, but more and more in many of the interventions developed by different people for healthcare, it is going towards a broader. If you look at not only AI, but technology, digital technology, as well as innovation and technology, going towards chatbot, going towards using more and more AI technology interventions. So I think it would influence healthcare not only in terms of efficiency, but also in effectiveness, as well as reaching more people where face-to-face interventions may not be able to reach.
So I've also seen how AI has been, and smart technology comes into play when there's surgery and optimizing healthcare system. I've even seen in China there are more and more robots. Actually, they have been taking up the role as a companion or a little helper for elderly who live on their own. So, for example, they can chat with them. They can deliver the drugs that they need every day. So, in the future, in the next 50 years, how will that progress and as an improve, or what are the directions in the future?
Okay, maybe I can speak
on
behalf of it, because bulk of New Frontiers healthcare operations are in China, and technology and artificial intelligence, as Professor Fong has mentioned, has significantly broadened over the last 12 to 18 months in terms of applications, in terms of what we could do. So I think for our group, because we're a private group and we are multi-format, that means we start from insurance to primary care, to hospitals, to rehab, home health, and the whole virtual care as well as physical care. We have been kind of discovering very significant new applications where perhaps we could improve patient journey, patient experience, and at the same time provide better cost management. So, for example, initially, obviously, imaging was a big area, but now, for example, navigation for doctors and consultants for our kind of system now have co-pilots where as our doctors speak to a patient, the co-pilot kind of recognize the voice and then provides guidance and navigations and potentially guardrails, but as well as recommendations to the doctors in terms of medications and advice and pathways, etc. And by the end of it, for those that run hospital systems know that quality of medical records obviously a huge deal, and compliance. In the past, our doctors take perhaps 30 to 40% of their time preparing for medical records, writing medical records, and particularly in compliance with the Chinese Health Bureau's requirements. So all of that could be shrunk significantly because the transcription at the end of the conversation now becomes a compliant set of records that could be processed and reviewed and edited and so on and so forth. So that's one aspect. Secondly is we're now finding ways to deliver our services outside of our facilities. So our group is a big believer that while obviously we run I think now 33 hospitals within China and 200 also outpatient centers or so. But one of our biggest pushes to take delivery of healthcare outside of the four walls into the homes, because we believe that with aging population, the care should be happen, or the bulk of that care should be happen more so virtually as well as remotely at homes. So today, actually, even today, about our home visit volume is about 20x of our hospital outpatient volume. So it's becoming a very major theme for us. But in the past, we didn't have the tools to provide remote management. It was largely labor-based services, but now with the implementation of wearables and sensors and new technologies, and with the cost curve coming down significantly, we're now finding ways to install kind of wearables and sensors that we can start to track both health data as well as activity data, assessing forest, gait, sleeping patterns, but as well as the wealth of health data, and all of that information gets fed back to our insurance program that allows us to provide better underwriting, allows us to do chronic disease management, prescription top-ups, and compliance into medical advice, and so on and so forth. So many of these things are there where ultimately in the past, perhaps 12, 18 months ago, I think either it's too expensive or we didn't have the algorithm that's available to do so, now have become a lot cheaper and available, and allows us to now provide new installations and new modules that we could enhance better patient experience and reduce costs. So, and I think this is the big trend. So even our group in the past, perhaps technology or artificial intelligence was perhaps top 5 of our strategic initiative. Now it's number 1 in our strategic initiative. So we're allocating a lot more R&D money and technology investments into doing that. And we see this as being where the future of healthcare is.
I have a point to note or to ask. That is, it all sounds very helpful and fascinating and all that. It sounds like an amazing plan, but it also sounds like a very expensive plan. So I just would really want to see, while AI are supposed to cut cost in future, but does R&D take up a lot of cost? And how does that come, how does the resource come from?
So for the 2 examples that I just mentioned, there's significantly cost saving because consultants and doctors are very expensive. If they spend 40% of their time doing administration and medical records, it's obviously not a good use of money and or resource and time. And so with that shrinking to perhaps in the future 5% or 10%, that's significant cost saving. And then, what I just described in terms of home environment, because sensors and wearables have become so cheap. So the production cost of this would be about 100 RMB. And you could install, wearables. And if you don't need the screen, it's a lot cheaper. And sensors for perhaps the whole installation would cost perhaps several hundred RMB. And if you do it on a kind of subscription basis, it's very cheap. And our insurance company would be very willing to pay for that because we have that data and information and it allows us to do better healthcare underwriting at home.
And so how's the reaction overall within the citizens? Do they love it?
Well, we're still trialing.
So it's still initial stage.
We're still trialing. I think at least the payers love it. And whether
I'm sure.
Yeah.
Does Dr. Mack want to put in a few thoughts too?
Yeah, so, I wear actually a few hats. So I'm a concerned neurosurgeon, a brain surgeon. So I'm also, I consider myself as an engineer for smart hospitals and smart systems for the hospital authority and in particular Kowloon Central Cluster. As a frontline doctor, which I still do lots of operations, I did 2 yesterday, for example. I have 2 perspectives for AI development. So first of all, it's micro, and the other is macro. So for micro development, it's down to the patient level and the doctor's level. So actually, your question is that what are we looking into in the coming 15 years? What I'm going to tell you, AI is already here. For example, from radiology, that is X-ray films or CT films. In the past, we're not talking about the really old days that when I was an intern, that I still remember that I need to take out the films, we call it wet films, from the large bag, and then flip it out and look at from the light box. Gone with the days, and now it's digitalized. And like 10 years ago, the doctors, radiologists, they will sit behind the computer, and then they will read the films, and then they type in reports. And this is how it goes. But today, we already have AI implemented in lots of the hospital authority hospitals and clinics already. For example, from chest x-rays to brain scans. The AI system can already process preliminarily the data, and then they can actually pick up lesions that can otherwise be missed or easily be missed by doctors. Especially we're talking about an aging population. There's a retiring a large group of doctors who reach the retirement age. And of course, the whole world, as in Hong Kong, are short of doctors. Not only Hong Kong, but it's a worldwide problem. So AI can help, first of all, to help tackle the attrition problem. There's a manpower shortage. And secondly, it can be actually working tirelessly 24/7 without the need to sleep unless there's out of electricity. It doesn't fatigue. And then, fatigue is a big problem with human beings. Now, I'm sure that some of you might be wondering, the mind may be wondering now because of the full lunch, that is norm, that is fatigue. But the computer will not. So without this factor of human error, then it can be even more accurate. And for doctors, we're very, very cautious of not making a mistake that will cost the patient's life. Okay, so the radiologist part is here. And secondly, for treating patients in the past, it's reactive. Say, for example, if you've got unluckily cancer, okay, then we offer treatment. So this is reactive. That is, you've got the disease, then respond. However, in the future, and actually it's now already, we're talking about preventive medicine and also predictive medicine. So what we're doing now in our hospital, for example, we're developing deterioration models using big data, conglomerating a lot of vital signs, for example, that digitalized already. So for the audience, what is digital? Anyone have used a fax machine for students? Do you know what's a fax machine? Probably not. So that's analog. So now we're talking about computer, emails, WhatsApp, they are digital. So we're using the digital data and, for example, the vital signs, for example, blood pressure, a temperature. They're all charted digitally already, and they're automated, like using the IoT devices, which I've the privilege to visit Professor Feng's wonderful smart hospital, and I learned a lot from the facility, and they're all connected, and same as my hospital as well. So we connect all these information and give a prediction. So the doctors will know, for example, patient A is going to deteriorate in the coming 24 hours with a 90% chance, where patient B, he is going to be safe. So that leads to another level, the macro level. Now in Hong Kong, we're short of hospital beds because of the land problem, and the public system takes care of 85% of the population in Hong Kong. So we need a quick turnover of beds, especially during COVID time. For example, for my hospital in Queen Elizabeth Hospital, it has been turned into a designated COVID hospital back then. So what we're using the system in AI is that we predict which patients are going to be safe and stable, and they can be discharged home as early and, of course, as safe as possible. And this is made possible by using AI, and we've also developed a command center to link up all these kind of information together, and we successfully transformed the Queen Elizabeth Hospital, busy tertiary referral center, to a COVID-designated hospital within 2 weeks' time. So this is just an illustration of lots and lots of facets of AI, how it's helping already, if not going to help, the healthcare system in Hong Kong.
I don't know why, from this pure discussion of the health topic, all of a sudden I thought of a drama. I don't know any one of you have heard of that. It's a drama called Grey's Anatomy. It's a medical drama. It's so good. I recommend everybody to watch it just to kill time, or if you ever want to learn about the medical world. They have 20 seasons, and the fact that they have been filming it for so many years shows how the technology has advanced, and throughout that advancement, how that can, cure, heal, and help people. So I just thought about that. And on that light note, let's switch to another aspect of the health topic. Now, the second subject that I would really want to discuss today during this panel is mental health. I think that mental health issue is something that's affecting not just Hong Kong, it's a world problem, it's a global problem. There's mental health day, mental health awareness initiatives everywhere in the world. Obviously, in the past few years, there's COVID, there's a pandemic. I've heard a lot of stories about how people can't cope with the real life because they have been stuck too long at home. There's emotional problems, there's some mental problems, and also with social media, you kids, you're on your phone all the time, and you tend to, because of peer pressure, you're on your phone all the time, and there's social media, and you compare yourself, and then you also need to balance out your academics, etc. So mental health issue really, it's not just affecting adults, but also, basically everybody from all ages. So right now in Hong Kong, there are a lot of mental health initiatives. For example, there's a hotline, there's home visits, they are training up people to help identify people with possible problems and symptoms, etc. So is it true that the Hong Kong government is really putting all their hearts into pouring their efforts into working out more initiatives, and how do we think about basically how can we further help people who might be combating against mental health? That's how, because a lot of times I think people with possible anxiety, depression, they know or they might not know, and they are very scared to reach out. I think that's the problem. So from your experience, like how should the administration help in basically help these patients or people as such, and yeah. Any speakers would like to add?
Okay, sure. Sure, I think, the World Health Organization actually said, health is not only physical health, it's also mental health. So no health without mental health. So therefore, it denotes how important it is. Obviously, especially after COVID, actually we notice there are more and more different mental health problems. On the one hand, I think we should have more practitioners that deal with these mental health problems. But on the other hand, if we look into the future, prevention is important, because if we continue to treat only treatment and only, build hospitals, psychiatric hospitals to deal with the mental health problems, and without looking into prevention, then I'm sure there will be more mental health problems coming. Especially the government is now embarking on a primary healthcare new journey where there are lots of these district health centers, in all the 18 districts in Hong Kong, dealing with primary, secondary, and tertiary prevention. So I think preventive interventions would be very important. And also I think mental health would not only defer to practitioners. I think everyone in this room would be also, responsible for your own health. It's also related. For example, there are, youth suicide and also other, suicide, mental health problems. The schools, the parents are also, part of this whole whole game of, coming together to improve people's mental health in addition to the individual.
So are there any examples how, before we wrap up the panel discussion, are there any examples of how, or not just on mental health subject, but how should universities and private sector join hands in creating initiatives, be it mental health or any problems, basically? Do we have any input on that?
I think there are several. I mean, certainly after COVID, actually we can see the problem, somehow exaggerated or expressed in a more explicit manner in this community, both in terms of like suicidal rate and all sorts of things. And I think we have to, going back, we've been talking about mental health as an issue, as a health system challenges for decades, and it's continued to be a challenge. And we have to ask the question, what are the barriers in order to actually ensure the sort of really mental health of the population as a whole? And certainly, there are things like stigma. Stigma continues the problem. There are things like access to sort of primary care problems, certainly. To what extent primary care and a practitioner and the way primary care is organized and be able to actually address sort of mental health problem. But also cost as well. Barring from the public sector, of course, public sector is crowded with patients, long queues and all that, although you don't have to pay a lot. But in the private sector, it's expensive. Seeing a psychiatrist, seeing a clinical psychologist is expensive, and rightly so, because they spend a lot of time with the patient, a lot of attention, but it's not many people can afford. So we have to find a solution that is actually based at the primary care level, that can be actually infiltrated to schools, to workplace, to families, that will be able to actually support. We all have life experiences, and we have ups and downs in our life. Sometimes we feel very excited about things, and sometimes we feel down a little bit. This is actually human nature, So it is those down moments where we will be able to seek helping hands, seek support with our family or peers or whatever. I think that level of sort of community building is important. And therefore, it speaks a lot on alternative solutions apart to formal care, like psychiatrists, clinical psychologists, and all that, the informal aspect. Recently, I've read a report which is produced by Man Hong Kong on their pilot scheme of actually training young people like you as youth mental well-being practitioners, that provide peer support, train, supervise peer support to like secondary school students and people in adolescence when they face stress, how to accommodate the stress, which produce very positive and encouraging results. And at the Chinese University, at the Department of Psychology, we've been actually adopting, again, we talk about UK, so model developed from the Success University on psychological well-being practitioners. So we've been training all those kind of, maybe you could, I don't know, maybe not be fair to say that they are sub-professional, but actually more available, the trained staff that will be able to provide more accessible and cost-effective psychological support and well-being. I think these are the models that we need to sort of explore, new models And I think universities certainly have a role to play because it's through education we can bring about innovation. Through research, we can pilot new model of care, new way of providing care, and this is what as CHK we've been doing. And I think on this, especially in the private sector, you also have the big role to play. Private sector is not always about earning money, but it's also about how to actually make private healthcare affordable. I think this is actually should be one of the missions as well. I'm sure Carl will share that mission as well.
Absolutely, I agree so much because it's different community and different parties joining hands to help the world make the world a better place. So thank you very much for our speakers for the input. Round of applause for our speakers. Now I am sure that our students have a lot of questions to ask our speakers. So for questions that you would like to ask, you can raise your hand and we will assist you. And you can also ask in any language that you feel comfortable. So this boy first.
All right. So my name's Darren Pun, and first of all, Professor Sophia Chan, thank you for your hard work and contributions during the COVID period. I remember watching the news with my family every 4:30 on TVB, yeah. So, okay, so to get on with my question. Well, actually, I think all of you guys can share your opinions on this matter, which is, I think as you guys all know, ChatGPT can pass a medical exam. And a lot of medicine now, as you've just mentioned, for example, chatbots can do preliminary diagnoses. And in a lot of fields such as radiology and laparoscopic surgery, it's mostly like AI. So I would like to know, what are your opinions on what the modern doctor or like the doctor in the future, maybe 10, 15 years later will be like? Because like, as a secondary student, I'm also interested in going into the medical field. So what will medical education be like in the future? Will doctors be like, sort of like pilots and AI being autopilot, if you know what I mean? Or will the doctor become something else, an entirely new profession whatsoever? Yep, I'd love to hear your thoughts on that.
Thank you, Darren.
Well, maybe I give a quick answer. As a doctor, I'm not afraid of AI. And as a matter of fact, we should use it as a tool, as an assistant. Now, I like the term actually co-pilot. Co-pilot, AI is a good co-pilot, just like your analogy, is not going to overtake a doctor's role. Because being a doctor is more complicated than you think. We need to have empathy. Empathy, if you know what it means you think in another person's shoes. It is something that AI lacks. And actually, I'm working on quite a number of projects on AI, and prompt engineering is something that is very popular now. It's not about it's like zero coding. Is not using Python or C++, etc. But then you write the prompts to guide how the AI thinks. Now, whatever we ask no matter how sophisticated we're asking the ChatGPT or other large language models, LLMs. By the way, ChatGPT is just one of these. They're not going to show adequate empathy. So back to your question, why does it pass a medical exam? To be honest with you, it's cheating because it's gathering all the data from online and it's kind of confabulating. Now for doctors, we never confabulate. It is very dangerous to confabulate. But then taking exams is different from being practicing. Taking exam is just yes and no. You get the answer right or answer wrong. But then as a doctor, we cannot lie to our patient, or we cannot say something we don't know, but yet we think we make it up and explain to the patient. So I would say in the future, doctors still would remain a large part of the same role which my mentors used to be, or like Professor Fong used to be, or like Dr. Ko is practicing been for decades. But then we need to make use of AI to take over some tedious work. For example, as I mentioned, diagnosis to prediction. Prediction is like intuition. Okay, sometimes we have intuition, we think this patient is going to turn bad because of just a feeling, okay? But AI is going to make it more scientific. So I hope I answered your question.
Let me supplement that by quoting Professor Joseph Song, who is our previous Vice Chancellor. Since he's now in Singapore and doing a lot of research and study on especially on the ethical issues in relation to the use of AI. But he, last December, I invited him to come back, and then in our seminar, in symposium, he talked about AI. And he ended his talk with one quote, which I think is very important. And he said, in the future, AI is not going to replace doctors. But doctors who do not use AI will be replaced by doctors who use AI.
Yeah, exactly, I agree.
Okay, we have another question.
Hi, my name is Bess from Harrow School, Hong Kong, and my question is worded quite similarly, but it's actually directed towards Mr. Carl Wu. You mentioned that there are apps that are tailored towards tracking your sleep and tracking, more specific internal regulations about you. And I feel like the reason why doctors currently outweigh AI is because they're more specific, they're more empathetic, and they tailor towards the personal biology of different people, which is why they have more expertise in that area. But wouldn't you say with the rise of more of these technological developments, these apps can technically help diagnose the patients themselves, and that they're able to utilize, you sleep more, I suppose you take drugs, something like of those areas, and to say that, okay, this disease is this level of severity, therefore you need these kind of steps of regulation. And wouldn't you say that it's more important for those patients who can't afford healthcare, and whereas in the topic of empathy wouldn't be as necessary as finding an immediate cure? Thank you very much.
Thank you for the question. So I do want to echo the previous point, which is for us, obviously, technology has become our most important initiative, but our entire focus is to create tools so our practitioners can be more effective, can provide safer, higher quality services to our patients. So I agree that these technology will never be able to replace the practitioners themselves, because there are judgments or empathies and other things that really, at least in the foreseeable future, I don't foresee us replacing what we currently have. But it's meant to make our practice safer and of higher quality. Now, these apps that you mentioned, they've always been in existence. I think some of the shortcomings of these apps prior to some of the things that we've been trying to do is that perhaps a lot of patients fall out of habit from using them, or certain patients didn't have the professional guidance to use them, or sometimes the data become non-medical or did not come with medical advice or relevance, and then they fall out of habit, or perhaps that no one ended up paying for those services because healthcare is who pays for it, what's your outcome, why certain things are done that way. And the scenario that I mentioned just now, perhaps creating these sensors and wearables into the home environment and track certain data, our hope is that you could link up these stakeholders, because the stakeholders that I'm talking about is the clinicians in the hospitals, the patients or / the customers, and then ultimately the payers, which are the insurance companies. Because I feel that in order to be successful, all of these people have to come in line. And so what I just described as a scenario is that if the data only stays within the smartphone of the patients, it's very likely, as per other cases, they will fall out of habit and it becomes irrelevant over time, which has been the case. What I hope is that this data actually now linked back to our primary care, cardiologists, primary care doctors, and they could use that to work with the patients to achieve certain outcomes. And I also mentioned the insurers are very happy to see that outcome, because that data gets fed back to the insurance company so that we could do better underwriting and then incentivize the clinicians and the patients to work towards better outcome. Now, in the past, these were separate, disparate parties, but what's unique about our company is that we play different roles. We do home health, we have primary care, we have cardiologists, we have insurance companies, and they all kind of work together to achieve that outcome. Ultimately, I don't know whether we'll be successful, but again, in order for a platform or a proposition like this to be successful, I feel that getting the stakeholders to work is what is important here.
Thank you very much. Are there any more questions? Over here, please.
Hello, my name is Ethan and I'm from VSA. Thank you for the presentation. Can I ask that what collaborations can be done with other countries to address the problem of Hong Kong's rapidly aging population?
Well, I think it's not only Hong Kong, but it's aging population around the world. So Hong Kong is not doing that bad, actually. I think the government has been trying to promote, for example, the young couples to give birth to the younger, to make the population, the average age younger. And if you talk about other developed countries, for example, Japan, it's really a bad issue. Now, of course, we still face a problem of doctors retiring and also public sector doctors going to the private sector for practice. Now, for example, the Hospital Authority and also the government of Hong Kong has been working really hard in introducing non-locally trained doctors. For example, those who work or studied and worked in the UK, and also some around the world, for example, in the GBA and also China as well, where language is not a big problem. Now, this is to create more supply to the healthcare system. Now, of course, we also know that there's a problem that no matter how active we are trying to attract doctors to come to Hong Kong, there still will be a shortage. So that's why AI comes into place. Some repetitive work or some on-call work can actually be made more effective, if not, I won't say the word replacing, but will be more effective with AI. And as mentioned, this has already been happening. And something actually to supplement, which I agree with Carl as well, is not only the private sector that use the wearables monitoring, but also in public sector, because actually a lot of the population in Hong Kong actually is taken care of by the public sector in the primary healthcare. We're actually establishing quite a robust model of telemedicine. I don't know if you've have family who've suffered from COVID and you've used the service of the telemedicine. I see some heads nodding there of getting the medicine for COVID patients. I myself have tried it. I've got COVID back then, of course, and it's really impressive. And we're also working on a model of remote monitoring using wearables, using sensors, and also something less sophisticated, using just questionnaires or using self-reporting tools, which are all can be done by using just a smartphone. And then we have the algorithms behind, and that can reduce the need for hospitalization. So the scarce resource mainly is about the hospital beds and also the number of doctors who take care of the patients who are really sick. So, and also Professor Sophia Chan has been working really hard previously and also currently on the primary healthcare. So Hong Kong is an interesting system that primary healthcare is less established than the rest of the world. For example, when compared to the UK, that patients, when they get sick, they jump directly to see the specialists, whereas around the world, it's actually to see the GPs first. Now, we're working on that, and hopefully that will solve at least part of the problem in the future.
Let me chip in a little bit in terms of the aging population. So when you talk about aging population, you should not actually just focus on health and care alone. I think going back to the very fundamental issue, it's how age-friendly is the living environment for the elderly. I think that's the most important aspect. And say, for example, in Hong Kong, 55% of our population live in public housing estate. And we have to ask the question, how age-friendly are our public housing estates in order to enable and empower our elderly citizens like me, to live an active life, to be healthy, to be to create an environment that enables us to be socialize, take loneliness away from us. This is part of the mental health as well. So these are all important aspects. And I think at the present moment, there's awareness in Hong Kong on that, especially some are related to on the university side, like at our university again, across the railway station in our School of Architecture, we start to have groups to actually look into this particular aspect. And I know the larger community, of sort of planning, architect, build environment, everybody is actually looking at that, how to actually make sure that our living environment is conducive to health, not healthcare, right? I think this is important. And that's why when you talk about health, aging population, you can see that it's not just about doctors and nurses. You've got a much broader picture. Everybody has a role to play. Yeah? Everybody can contribute something, in the future to actually make, aging population not a problem. Yeah, it's not a problem. It's a challenge, but we don't see that as a problem.
Maybe I can also add that because our group is very focused on the aging population, because I think the direct implications of aging population is, we have a health economics challenge, which is as population becomes older, the disease burden increases because most of the disease is health related, and on average, 60 plus or 70 plus population spends almost 10x more on healthcare expenditure than the younger populations. And I think this requires very significant kind of public policy changes, because what's the direct, most immediate implication that we're going to see, especially in China, I think Hong Kong slightly better, is that a lot of patients will, because the way the health system is designed in China, and to some extent Hong Kong as well, is that a lot of the resource stays in tertiary acute settings. And with patients going into tertiary acute settings, it's going to, health inflation, supply shortage. It's a problem that you cannot just deal with by, if you build more tertiary acute hospitals, become even more expensive. So in our view, is the way to do it is, one is you have to kind of push and build a significant primary care, thank you Professor Chen, primary care network, and then on the other hand, create a significant post-acute network. And that's why our group have been, over the years, been kind of investing heavily into rehabilitation health, home health. And the whole point is that so patients can get discharged more quickly, more safely into kind of safe environments, cheaper environments, and then we keep the resource in tertiary acute settings for people that really need it, because they're coming, and it's very predictable as anyone that studied demographics.
Thank you. Do we have? We see a lot of hands, so over here, please.
Shall we take one last question, as we are quite short of time?
Okay.
Sure. Hello, here's Helen, and currently I'm an engineering student from a CHK. So I'm also doing some kind of a mental health project at school. And because in engineering school, most of our training focuses on like rational thinking or logical deduction. But talking about mental health problems, there's so many things to do with empathy, because we have to actively listen to our patients or to our clients. So my question is, are there some skill or some way for an engineer to who prioritize logical thinking over empathy or emotion to contribute to the mental health or make some positive impacts? Thank you.
Well, let me address that. I don't know how to. I have some interaction with biomedical engineering department from CHK, but most of my interaction are at the medical school. And to be very frank, Calvin talked about, Dr. Mack talked about empathy, which is important. So at the medical school, we are also thinking, working on how to actually train and develop our doctors to be more empathetic. And we are also starting to explore ways to introduce or strengthen empathy training in our medical curriculum, and maybe for our sort of nurses as well. So these are the kind of things that we are exploring. But it's actually very difficult to teach, I must admit. It's not easy to teach, and because some of these are experiential. So which is important, human-to-human interaction. But I think increasingly this will become an important part, of our education as a whole. I hope, because with more IT, more technology, more engineer, it also speaks for the fact that we really need more human-to-human interaction and empathy with each other.
Does Professor Chen want to
Yeah,
chime?
I think it's good to hear that you recognize, not only rational thinking is important, but then the development of empathy is also important. I agree with Dr. Fong that it's very difficult to teach, but I think you should capitalize on any opportunity of having human touch, with people, and I think through these experience that you would really slowly develop, empathy. Just now we talk about AI. I think actually AI can never replace human touch. There are things like doctor-patient relationship, and all these relationships are developed based on interactions, compassion, and also empathy. So these are soft skills that I think everyone would have to develop in addition to technology.
Yes, may I just add a bit? I see a lot of audiences are youth, actually. I myself I'm serving on the Youth Development Commission of the government as well as a court member. So we really emphasize on mental health. It's not a health problem, but we want to improve the mental health in general, especially for the younger generation. We know that it's very difficult to live a good life in Hong Kong, actually. It's a lot of stresses, education system, the prospect, and lots of things. Now, to stay empathetic is important, that is to stay connected. I think it's important to stay connected via both online and offline. Now, if I'm going to tell you, throw your smartphones, lock it up, and join a day camp or so, how many of you are going to join it? Show of hands? Good. But
just a few.
Okay, just a few, I would say. Less than half. The prerequisite is just throw away your smartphone. No, you're not going to do that. So the important way to do this is stay online to offline and offline back to online. And how to do this is that you make use of technology to stay connected with your peers, with your friends, and to embrace knowledge and to embrace change. One of the stresses is always change. It's human nature to be skeptical of changes because of the uncertainty. Even though it might do good, but you will be still afraid. So it happens to you every day about your classes tomorrow, your examination next month, or the DSE, or the other kinds of all sorts of IB, etc., the examinations, which I've already got lost contact a little bit, yet I'm glad that I'm actually the president of the LaSalle College Old Boys Association, so I've still be connected with the school. But anyways, back to the topic is that you need to stay connected. To be empathetic, you need to know what others are thinking, and to keep pace of what the world is rapidly evolving, and in this way, you will be aware of the happenings as well. I think this is the way to be at least to have a feeling of being in control of yourself and in control of things happening around you, and that can ease the stress, and hopefully that will improve the mental health as well in general.
Thank you very much. Let's give a round of applause for our 4 speakers today. Wonderful exchange. Thank you very much. I hope you all have some beautiful intakes. Thank you very much.
Thank you, Sharon, as our moderator, and thank you, our panelists. Before you leave, we would like to present all of you, our panelists and our moderator, some certificates. May we also invite our co-founders and committee and subcommittee members to join our group photo.